again on my YouTube channel. Okay, my name is Student Intias. I was studying at the Mount Wijaya Catholic Polytechnic in Semarang, Pharmacy Study Program. The topic this time is the Grade 6 Final Examination subject in a conversation subject by Mr. Gregorius Darwijoyoko. And now, I will tell you what is happening now, which is about the coronavirus pandemic and alternative medicine derived from propolis and aloe vera. Okay, we'll first discuss about coronavirus, how the symptoms and transmissions. What is the coronavirus? Coronavirus is a family of viruses found in human and animals. Some of the viruses can correct humans and cause various diseases, ranging from general illnesses such as flu to more fatal diseases such as Middle East Respiratory Syndrome or MERS and Severe Acute Respiratory Syndrome or SARS. And how is the coronavirus spread? Often, this virus spreads between humans and humans through liquid droplets from the mouth and nose when an infected person is coughing or sneezing, similar to the way the flu transmits. Fluid drops from the patient's mouth and nose can fall and remain on the mouth and nose of other people who are nearby, even sucks and absorbs into the person's lungs through his nose. And what are the symptoms experienced by coronavirus patient? Symptoms include fever, coughing, and shortness of breath. The Center for Disease Control and Prevention, or CDC, believe that coronavirus patients can experience these symptoms from 2 days to 14 days after exposure to the virus. And what is the most appropriate treatment for this coronavirus? Until now, there has not been found a vaccine to prevent someone infected with coronavirus. The best way to protect ourselves is to avoid conditions or places where you have the potential to be exposed to the virus. A disease prevention agency in the United States, the Center for Disease Control and Prevention, or CDC, suggests you a number of things below to prevent the spread of respiratory disease by number 1, wash your hand more with soap and water for at least 20 seconds, especially before you go out of the bedroom, before eating, and after you blow your nose or cough or sneeze. And number 2, if water and soap are not available, use an alcohol hand sanitizer with an alcohol content of at least 70%. And number 3, avoid touching your face before washing your hands. And number 4, avoid close contact with sick people. And number 5, stay home if you are sick. And number 6, cover your mouth when coughing and sneezing using a tissue. And number 7, or last, expand to clean up your belongings and furniture in your home. There are currently many studies on various sorts of traditional and synthetic drugs to kill and inhibit the spread of this coronavirus. But in fact, this research still requires further steps, such as clinical trials and toxicity tests, and as in alternative medicines derived from propolis and aloe vera. And one of the researchers from the Faculty of Engineering University of Indonesia, or FTUE, Dr. Eng Muhammad Sahlan, Sarjana Sains and Master Engineering, developed a propolis compound native to Indonesia produced by the bee Tetragonula pyrrhoi AF as an alternative treatment and prevention of the spread of the coronavirus or Covid-19. Propolis is proven to have natural inhibiting components that can be used to produce drugs with minimal negative effects on both the human body and available natural resources. Sahlan said that the composition of propolis is not always the same throughout the world. In this study, the propolis compound comes from the tetragonal theory of B. It should be understood that propolis has different characteristics depending on the source of the plant and its location. The difference in plant source, location, and research process will also distinguish the propolis compound produced. Currently, several countries are developing drugs and vaccines for COVID-19. One of them is China, which developed a drug based on research published by Professor Yang from Shanghai Tech University in January 2020. In his research, Professor what managed to map the structure of the coronavirus protein found that the coronavirus that causes COVID-19 must attack the living cells, or in this case the human lung, before injecting its genetic structure into these living cells to multiply. To break this activity, a chemical inhibitor called N3 was developed as an alternative drug for COVID-19. Propolis has the property of inhibiting the process of attaching viruses to human cells similar to N3 compounds. Using the structure of the existing COVID-19 model, propolis compounds were tested by comparing the bonds in the N3 compounds to see whether they could form bonds in the COVID-19 virus. The test research showed that 3 of the 9 compounds present in Indonesian original propolis had a good adhering strength to the COVID-19 virus. If compound N3 has a value of -8 and compound Sulawesins has a value of -7.9 and Sulawesins B -7.6, and then deoxypodophylotoxin -7.5, and the more negative the value on, shows the greater ability of the compound to attack to the COVID-19 virus. This makes the virus cannot stick to human living cells and then multiply. Of course, this research has not yet entered the clinical stage, but the results of this study are certainly very promising to be developed into alternative medicine from Indonesia to cure or reduce the development of the coronavirus not only in Indonesia, but also in other countries. In the midst of an outbreak, the corona COVID-19 virus that has not yet subsided, various types of typical plants in Indonesia are said to be effective in preventing this virus. One of the plants is aloe vera. Aloe vera has ingredients that can ward off the corona COVID-19 virus. So, in addition to beauty, other benefits of aloe vera can also be for health. Aloe vera has anti-inflammatory and antibacterial properties, making it suitable for use as a skin surface cleansing agent, such as a hand sanitizer. The compounds in aloe vera can not only clean the hands of bacteria and viruses, but also can make the hands become more moist. That way, hand sanitizer from aloe vera are relatively safer when compared to hand sanitizer in general that are dominated by chemicals. The benefits of aloe vera to ward off corona COVID-19 virus, one of which can be obtained by processing this plant into a hand sanitizer. Aloe vera texture in the form of soft gel is very suitable and flexible to be processed into a hand sanitizer. With aloe vera, you can make liquid or slightly dense hand sanitizers like gel. To make a natural hand sanitizer with aloe vera, you also need to provide various other ingredients such as wet vinegar, any essential aroma pure oil, and 1 spoonful of isopropyl alcohol or IPA. And then, besides protecting from the outside, it turns out that aloe vera can also protect you from the corona COVID-19 virus from the inside. The way you just eat aloe vera, eating aloe vera can provide many health benefits for the body. One of the benefits of aloe vera is to maintain endurance. In aloe vera, there are various compounds that are good for health, especially endurance, such as vitamin C and antioxidants. As you know, endurance becomes an important thing that determines the transmissions of the corona COVID-19 virus in a person's body. Someone with a weak immune system is more susceptible to contracting. So, by consuming aloe vera can keep you from the possibility of contracting the virus originating from China. To get the benefits of aloe vera, you must consume it by eating the flesh of the aloe vera plant. Don't worry, this type of plant can actually be processed into various types of fresh drinks. And then the conclusion is propolis as a natural antibiotic derived from fish can actually be used as an antivirus and maintain endurance. And aloe vera can also be used as an antibacterial and maintain endurance. Okay, that's all my explanation. Thank you and hope it's useful. Bye bye. See you.